Anxiety is a common mental health condition that affects millions of people worldwide. It is characterized by persistent feelings of worry, fear, and unease, which can significantly impact an individual's daily life and overall well-being. While anxiety is a natural response to stressful situations, it becomes a disorder when these feelings are excessive, irrational, and interfere with daily functioning. There are various treatment options available for managing anxiety, including psychotherapy, lifestyle changes, and medication. One of the most commonly prescribed medications for anxiety is fluoxetine, a selective serotonin reuptake inhibitor, SSRI, that has proven effective in treating anxiety disorders. Introduction to fluoxetine as an anxiety medication. Fluoxetine, also known by its brand name Prozac, is a widely used antidepressant medication that belongs to the SSRI class of drugs. While it was initially developed to treat depression, fluoxetine has also been found to be effective in managing various anxiety disorders, including generalized anxiety disorder, GAD, panic disorder, obsessive-compulsive disorder, OCD, and social anxiety disorder. Fluoxetine works by regulating the levels of serotonin, a neurotransmitter that plays a crucial role in regulating mood, anxiety, and other emotional processes. By increasing the availability of serotonin in the brain, fluoxetine can help alleviate the symptoms of anxiety and improve overall emotional well-being. How does fluoxetine work in managing anxiety? Fluoxetine works by inhibiting the reuptake of serotonin in the brain, which means it prevents the reabsorption of serotonin by the neurons that release it. This results in higher levels of serotonin in the synaptic cleft, the space between neurons where neurotransmitters are released and received. Serotonin is a neurotransmitter that plays a vital role in regulating mood, anxiety, and other emotional processes. By increasing the availability of serotonin in the brain, fluoxetine can help alleviate the symptoms of anxiety and improve overall emotional well-being. Here's a more detailed explanation of how fluoxetine works in managing anxiety. Serotonin is released from the presynaptic neuron into the synaptic cleft. Fluoxetine blocks the reuptake of serotonin by the presynaptic neuron, allowing more serotonin to remain in the synaptic cleft. The increased availability of serotonin in the synaptic cleft enhances serotonin signaling in the postsynaptic neuron. Enhanced serotonin signaling in the brain can help regulate mood, reduce anxiety, and improve emotional well-being. It's important to note that the full therapeutic effects of fluoxetine may take several weeks to become apparent, as the brain needs time to adapt to the increased serotonin levels. Benefits and effectiveness of fluoxetine for anxiety. Fluoxetine has been extensively studied and has demonstrated significant benefits in managing various anxiety disorders. Here are some of the key benefits and effectiveness of fluoxetine for anxiety. Generalized anxiety disorder, GAD. Fluoxetine has been shown to be effective in reducing the symptoms of GAD, including excessive worry, restlessness, irritability, and difficulty concentrating. Panic disorder. Fluoxetine can help reduce the frequency and severity of panic attacks, as well as the anticipatory anxiety associated with panic disorder. Obsessive-compulsive disorder, OCD. Fluoxetine has been found to be particularly effective in treating OCD, helping to reduce obsessive thoughts and compulsive behaviors. Social anxiety disorder. Fluoxetine can help alleviate the symptoms of social anxiety disorder, such as fear of social situations, self-consciousness, and avoidance behaviors. Improved quality of life. By effectively managing anxiety symptoms, fluoxetine can significantly improve an individual's overall quality of life, enabling them to engage in daily activities and social interactions with greater ease and confidence. Long-term effectiveness. Studies have shown that the benefits of fluoxetine in managing anxiety can be sustained over the long term, provided that treatment is continued as prescribed. It's important to note that the effectiveness of fluoxetine may vary from individual to individual, and some people may respond better to other medications or treatment approaches. Regular follow-up with a healthcare professional is essential to monitor progress and make any necessary adjustments to the treatment plan. Dosage and administration of fluoxetine for anxiety. Fluoxetine is typically available in tablet or capsule form and is taken orally. The dosage and administration of fluoxetine for anxiety may vary depending on the specific condition being treated, the individual's age, and other factors. Here are some general guidelines for the dosage and administration of fluoxetine for anxiety. Initial dosage. The recommended initial dosage of fluoxetine for anxiety is typically 10 mg once daily. This dosage may be increased gradually based on the individual's response and tolerance. Maintenance dosage. The typical maintenance dosage range for fluoxetine in the treatment of anxiety disorders is 20 mg to 60 mg per day. The dosage may be adjusted based on the individual's response and side effects. Administration. Fluoxetine can be taken with or without food, but it is generally recommended to take it at the same time each day to maintain consistent levels of the medication in the body. Dosage adjustments. Dosage adjustments may be necessary for individuals with certain medical conditions, such as liver or kidney impairment, or for those taking other medications that may interact with fluoxetine. It's important to follow the dosage instructions provided by your healthcare professional and not to adjust the dosage without consulting them first. Abruptly stopping or changing the dosage of fluoxetine can lead to withdrawal symptoms and should be avoided. Potential side effects of fluoxetine for anxiety. Like all medications, fluoxetine can cause side effects, although not everyone experiences them. It's important to be aware of the potential side effects and to report any concerning symptoms to your healthcare professional. Here are some common side effects associated with fluoxetine when used for anxiety. Gastrointestinal issues, nausea, diarrhea, constipation, and loss of appetite are common side effects, especially during the initial weeks of treatment. Sleep disturbances. Insomnia, vivid dreams, or drowsiness may occur. Headaches. Mild to moderate headaches are a common side effect. Sexual dysfunction. Fluoxetine may cause decreased libido, difficulty achieving orgasm, or other sexual side effects. Dizziness or lightheadedness. Some individuals may experience dizziness or a feeling of lightheadedness, especially when starting treatment or changing dosages. Dry mouth. Fluoxetine can cause a dry mouth sensation. Sweating. Increased sweating or night sweats may occur. Agitation or restlessness. Some individuals may experience increased feelings of agitation or restlessness. It's important to note that most side effects are typically mild and may subside as the body adjusts to the medication. However, if any side effects persist or become severe, it's essential to consult your healthcare professional for proper management or potential dosage adjustments. Precautions and considerations when using fluoxetine for anxiety. While fluoxetine can be an effective treatment for anxiety, there are certain precautions and considerations to keep in mind when using this medication. Suicide risk. Fluoxetine and other antidepressants may increase the risk of suicidal thoughts or behaviors, especially in children, adolescents, and young adults. Close monitoring by a healthcare professional is essential, especially during the initial stages of treatment. Serotonin syndrome. Fluoxetine can potentially cause serotonin syndrome, a rare but serious condition that occurs when serotonin levels become too high. Symptoms may include agitation, confusion, rapid heartbeat, and muscle rigidity. Seek immediate medical attention if these symptoms occur. Interactions with other medications. Fluoxetine can interact with various medications, including other antidepressants, certain pain medications, and supplements. It's crucial to inform your healthcare professional about all medications and supplements you are taking to avoid potential interactions. Pregnancy and breastfeeding. Fluoxetine should be used with caution during pregnancy and breastfeeding, as it may have potential risks for the developing fetus or nursing infant. Consult your healthcare professional for guidance on the appropriate use during these periods. Alcohol and substance abuse. Fluoxetine may impair judgment and increase the risk of adverse effects when combined with alcohol or other substances of abuse. It's recommended to avoid alcohol and recreational drugs while taking fluoxetine. Age and medical conditions. Fluoxetine may need to be adjusted or used with caution in certain age groups, such as the elderly, or individuals with specific medical conditions like liver or kidney impairment, seizure disorders, or bleeding disorders. Discontinuation symptoms. Abruptly stopping fluoxetine can lead to withdrawal symptoms, such as dizziness, nausea, headaches, and mood changes. It's important to follow your healthcare professional's instructions for gradually tapering off the medication to minimize these effects. By being aware of these precautions and considerations, and working closely with your healthcare professional, you can help ensure the safe and effective use of fluoxetine for managing anxiety. Managing anxiety with fluoxetine. Tips and strategies. While fluoxetine can be an effective treatment for anxiety, incorporating additional strategies and lifestyle changes can further enhance its benefits and promote overall well-being. Here are some tips and strategies to consider when managing anxiety with fluoxetine. Psychotherapy. Combining fluoxetine with psychotherapy, such as cognitive behavioral therapy, CBT, or mindfulness-based therapies, can be highly effective in managing anxiety. Psychotherapy can help you develop coping strategies, challenge negative thought patterns, and improve emotional regulation. Exercise and physical activity. Regular exercise and physical activity can help reduce stress and anxiety levels by releasing endorphins and improving mood. Aim for at least 30 minutes of moderate exercise most days of the week, such as brisk walking, swimming, or cycling. Stress management techniques. Incorporating stress management techniques like deep breathing exercises, progressive muscle relaxation, or meditation can help calm the mind and reduce anxiety symptoms. These practices can be particularly helpful when combined with fluoxetine. Healthy diet. A balanced and nutritious diet can support overall mental health and well-being. Focus on consuming whole foods, including fruits, vegetables, lean proteins, and healthy fats, while limiting processed and sugary foods. Adequate sleep. Prioritizing good sleep habits is essential for managing anxiety. Aim for 7-9 hours of quality sleep each night, and establish a consistent sleep routine. Avoid screens and stimulants before bedtime, and create a relaxing sleep environment. Social support. Building a strong support system of family, friends, or a support group can provide emotional support and a sense of community during challenging times. Sharing experiences and receiving encouragement can be invaluable in managing anxiety. Mindfulness and self-care. Practicing mindfulness techniques, such as meditation or yoga, can help cultivate present moment awareness and reduce rumination on anxious thoughts. Additionally, engaging in self-care activities that bring you joy and relaxation can promote overall well-being. Compliance with treatment. It's essential to take fluoxetine as prescribed by your healthcare professional and attend follow-up appointments to monitor progress and make any necessary adjustments to your treatment plan. Remember, managing anxiety is a journey, and it may take time and patience to find the right combination of strategies that work best for you. Consistently implementing these tips and strategies, along with taking fluoxetine as prescribed, can help you effectively manage anxiety and improve your overall quality of life. Frequently asked questions about fluoxetine for anxiety. When it comes to using fluoxetine for anxiety, there are many common questions and concerns that arise. Here are some frequently asked questions and their answers. How long does it take for fluoxetine to start working for anxiety? Fluoxetine typically takes 4-6 weeks to reach its full therapeutic effect for anxiety. However, some individuals may experience improvements in their symptoms within the first few weeks of starting treatment. Can fluoxetine be taken long-term for anxiety? Yes, fluoxetine can be taken long-term for the management of anxiety disorders. Many individuals continue to take fluoxetine for several months or even years to maintain symptom control and prevent relapse. Is fluoxetine addictive? No, fluoxetine is not considered an addictive substance. However, abruptly stopping fluoxetine can lead to withdrawal symptoms, so it's important to follow your healthcare professional's instructions for gradually tapering off the medication. Can fluoxetine cause weight gain or loss? Weight changes are a potential side effect of fluoxetine. Some individuals may experience weight gain, while others may experience weight loss. It's important to monitor your weight and discuss any significant changes with your healthcare professional. Can fluoxetine be taken with other medications? Fluoxetine can interact with various medications, including other antidepressants, certain pain medications, and supplements. It's crucial to inform your healthcare professional about all medications and supplements you are taking to avoid potential interactions. Are there any dietary restrictions while taking fluoxetine? There are no specific dietary restrictions while taking fluoxetine. However, it's generally recommended to follow a balanced and nutritious diet to support overall mental health and well-being. Can fluoxetine cause drowsiness or fatigue? Drowsiness or fatigue can be a side effect of fluoxetine, particularly during the initial stages of treatment. If these symptoms persist or become problematic, discuss them with your healthcare professional for potential dosage adjustments or alternative treatment options. Is it safe to take fluoxetine during pregnancy or while breastfeeding? Fluoxetine should be used with caution during pregnancy and breastfeeding, as it may have potential risks for the developing fetus or nursing infant. Consult your healthcare professional for guidance on the appropriate use during these periods. Can fluoxetine cause suicidal thoughts or behaviors? Fluoxetine and other antidepressants may increase the risk of suicidal thoughts or behaviors, especially in children, adolescents, and young adults. Close monitoring by a healthcare professional is essential, especially during the initial stages of treatment. What should I do if I miss a dose of fluoxetine? If you miss a dose of fluoxetine, take it as soon as you remember. However, if it's almost time for your next dose, skip the missed dose and continue with your regular schedule. Do not double up on doses to make up for a missed one. Remember, it's always best to consult with your healthcare professional if you have any specific concerns or questions regarding the use of fluoxetine for anxiety. They can provide personalized guidance and support based on your individual circumstances. Conclusion: the importance of consulting a healthcare professional for anxiety management with fluoxetine. Managing anxiety with fluoxetine can be an effective treatment approach, but it's crucial to work closely with a healthcare professional throughout the process. A healthcare professional, such as a psychiatrist, psychologist, or primary care physician, can provide personalized guidance and support to ensure the safe and effective use of fluoxetine.